Myocardial infarction.
Myocardial infarction?
Yes, correct. So this is cardiogenic shock. You know, yes, that the left ventricle sends the blood to whole body systems. And that's why if it fails, let's say it is myocardial infarction or it is heart failure with that it's not possible to control and similar things. Neurogenic shock, the results from dysfunction of nervous system following spinal cord injury. Usually it happens after car accidents. And this one is anaphylactic shock, severe allergic reaction within minutes to hours after exposure to foreign substance. So therefore, what can be an allergen that can cause anaphylactic shock? What do you think? What allergens do you know? Let's write them.
Food allergy, drug allergy.
Usually peanut, yes? That's
Yes.
why in the schools in the US already peanut is excluded from kids' lunch menu. Can bee stings be a reason?
Yes. Yes.
Yes, nuts. Yes, all nuts.
Yes,
Seafoods.
anything, you never know what will happen. Yes, once the patient can have just only a rash. So the second time when the patient takes this food, medication or bee sting, it can lead to anaphylactic shock. You never know. Every other encounter with this allergen can create more severe reaction. So I see answers from Tamar, from Karina. So thank you that you keep writing in the chat. And by this, you get your 10 points from the Zoom. Septic shock, sepsis. It's something connected with pus, yes, from general infection in the bloodstream. So it means that the pus is not local, it's in the blood. So when fever is present, but the body temperature falls. It could be consequences of uncontrollable pneumonia, meningitis, and so on. Hyperglycemic shock, elevated blood sugar levels due to forgotten injection of insulin. Do you see? It's very important that you could recognize the words hyper and hypo. Is very important because it can be fatal if someone confuses. Yes, hyperglycemic, it means blood sugar, blood glucose level is very high. Patient forgot to take the dose of insulin or forgot to take the medication, or patient took more carbohydrates, for example, white bread, pasta, cake, that was supposed to. Here, how we treat it, we inject insulin. Yes, this is the only way to bring it low rapidly. Unlike this, insulin or hypoglycemic shock, here either insulin was injected too much or patient didn't eat after injection or patient exercised too much without adjusting insulin dosage. And what we give here?
Insulin.
If we give insulin, your patient will die.
No, it's going to. We have to give him food, sugar.
So hypoglycemic. It depends. If your patient
some candy.
So it's good that you make mistakes in answers. The more mistakes you do when you are learning, the better. Yes, because if you verbalize the incorrect answer, it's possible that your classmates also think of it, but they didn't tell. And there is no incorrect answer when you are studying. So the more answers you go, the better you give. So hypo, if you see hypo, it means sugar is low. If you see insulin shock, it means insulin is high, yes? And here you need to estimate if your patient is able to swallow, if it is not a critical condition, and sometimes patient can faint, yes, can pass out. So if this patient is still alert and is able to swallow, you can give either milk or orange juice in order to keep it high. But if the patient cannot swallow, sometimes we can give them we put in the mouth moist with glucose pads, so they could go into the bloodstream, or if it is possible, we give them IV, intravenous glucose solution. So it depends where are we, yes?
Yes.
How to manage when the patient is in shock? So it depends on the cause, yes? If it is anaphylactic shock, if it is this one, so what is something that can be cause of losing the patient? Do you see swollen body parts?
Yes.
So it can happen with the trachea as well, inside the throat. It can become swollen and the oxygen cannot go inside the body. So if it is anaphylactic shock, the death becomes due to closing the airway, due to airway obstruction. So here we need to make sure that airway is open. For other types of shocks, we just keep, do you see this? This is in the state exam also, we keep the patient warm until paramedics arrive.
I have a question. You said if airway is open and if it's not open, what we should do?
If it is not open, usually medical offices have tracheostomy devices that they do intubation, and instrument goes inside, or they have to do external tracheostomy, made an opening so that the oxygen could go inside until paramedics arrive.
Oh, okay.
But usually the first help for anaphylactic shock is injection of EpiPen, same as adrenaline, and all patients in the US, all people, it doesn't matter if it is kid or an adult, if they have diagnosed allergy with this type of reaction, they have EpiPen. It is a syringe, orange color, which they can inject even when they are in the clothes. To have rapid result, they just inject from the pants on the thigh, and it helps rapidly, very fast.
Okay, thank you.
So what does it mean when the patient is in shock? Let's remember that it is lack of oxygen. It means less oxygen that the body needs because of low blood pressure. And there can be lots of signs, yes? Usually the most specific for it is low blood pressure, rapid pulse, and you see that patient color. Patient is pale, sometimes even can be cyanotic patient, cyanosis. Do you remember what does it mean?
Blue color of skin.
Blue color of the skin, correct. So another emergency situation could be bleeding. It can be either open or closed injury, so it could bleed. So closed injury wounds, bruise or contusion or hematoma, crush injuries. It means, if you see hematoma, accumulation of the blood under the skin. Do you see this one? It was a little injury and we have accumulation of the blood under the skin, so-called hematoma or bruise or contusion. And after this, it becomes bluish, then green, yellow, and then goes away. Open injuries when skin is broken. So when skin is not intact and you see a blood, it means it is open in injury. For example, laceration. This is an example of laceration, or an amputation when a body part, a limb is taken away. Yes, and we can see external hemorrhage. Do you remember what means hemorrhage?
Bleeding. Yeah.
Bleeding, yeah.
Bleeding.
Correct. It is medical term for bleeding. So when it is external bleeding, we can see the blood and we can put a pressure on it. But when it is internal bleeding, we cannot see this, yes? And usually when it is internal bleeding, the only way that you could understand that patient bleeding when lying, you check the blood pressure in lying position. Let's see, it is 120/80. When the patient stands, after 5 minutes, it becomes 110/60, and you understand that there is a bleeding. That's why we have change in blood pressure due to position change. and they need to take into ER, do the MRI or CT scan, and maybe open surgery. So here there are examples of types of soft tissue injuries: abrasion, which is scraping; laceration, as you saw in the picture in the example, tear the skin; and remember about amputation, tear away the limb. Usually it can be due to some accidents, but also due to medical conditions. For example, if patient is diabetic, there is a necrosis of the body parts, they have to do the amputation, yes, to establish the blood flow to the parts that are not in a necrosis situation yet. Karina, I see your message. So what is confusing? You are right, hypo and hyperglycemia are different. So what is confusing about the adrenaline? I see that your answer in the test was correct. For anaphylaxis, you put adrenaline, and it is the same as EpiPen injection. So if there are still questions, please write in the chat, I will answer to them. So how to manage the bleeding of soft tissue injuries? You apply gloves, remember, yes, how we call protective equipment, personal protective equipment, yes, you need to have it because you never know what these infections, what diseases this person has, yes? So you apply the gloves to minimize the infection. Then open several gauze pad packages and apply direct pressure to the wound with gauze pads. Hold the pressure for 20 minutes without removing it. If bleeding continues, so you put the pressure, but if you see that the gauze pad becomes red, it means bleeding still continues, you apply additional. You do not remove the old one, and you apply additional gauze on the wound. So this is what happens when a body part becomes severed. It means it detaches from the body. Usually it can happen in the factory when there are very sharp knives, or in the accident. Sometimes it happens. So what to do in this situation? You place the severe part in a plastic bag. Then this plastic bag you put in another plastic bag, and between these two bags you put ice or icy water. So ice doesn't come into contact with severe body part, but it stays cold, so it doesn't exaggerate the situation. What to do if there is an impaled object? It means a foreign object is inside the body. It could be in the joint, it could be in the muscle, it could be in the eye. What to do? Remember that we never remove the object, because if we remove it, the patient can bleed more than that moment. We never remove it. We just immobilize with this. So we place gauze pads around the object, we secure with tape and try to minimize the movement until they reach to the hospital. What to do if there is a burn? So they are classified according of the cause. We know that thermal burns, temperature, yes, it can be hot liquid, hot temperature, solid, gas, flame. Electrical, due to electricity or lightning, and chemical burns, contact to corrosive substances, and radiation, sunburn, radioactivity, similar heat burns. We also classify them according to their severity, how deep are they and how big are they. Superficial ones, first degree burn, limited to epidermis. Do you remember in epidermis, there is nothing in epidermis, just coming out hairs. Partial thickness burn, that involves epidermis and also dermis, and full thickness burn, third degree, that destroys all skin layers. So we classify it with body surface area. And do you see how we classify? Let me make it bigger. So it depends what parts are burn. So if only face is burn of the adult, it is 9% BSA burn. We classify like this. If the head, if for kid, it is 18% because we know that the head for kid compared with the body is bigger than the head of the adult compared with the body. Yes, because kids' body is smaller than adults. So if only one arm is burned, it is 90%. If two arms, 18%. Who can tell me if for adult we have burned front, back, and also an arm? What percentage will we have?
$45.
50% or
So you got a patient who has burn in front, it is a dog,
Mhm.
in the back and one arm.
45.
45. So how you get it?
80% is front and 18 back and 9 hand.
So you
32 and 41.
36 and plus 9. Yes,
Oh,
it will be
Oh,
45.
45.
Correct. So this is how you calculate the burn of body surface area. Okay. How to manage the burn? We eliminate first of all the source by washing area with cool water, and we notify the physician. So here it is our subject, emergency procedures in the medical office. So if someone comes and something happens and there is a burn in your office, and continually assess the patient airway, breathing, and circulation. Do you see ABC? So nowadays, after an update of situation, instead of ABC, we have CAB. So first of all, we check circulation, then airway, then breathing. Yes, according to circulation. Every time we need to update everything because you know that medicine is not it's not staying on the same place. Yes, it goes back, but the majority of times goes forward, circulation, airway, and breathing. Okay, remove all jewelry and clothes as necessary to evaluate the burn and document time and type of treatment. Another part is about musculoskeletal injuries. It means both are injured, muscles and the bones, yes? So I put this picture because it shows you the difference of types of the injury. You see it is blue and red. So in order for you to differentiate better the sprain and strain, because we keep confusing it. So for state exam, you don't have to differentiate, even if you don't remember how to differentiate, it's okay. Just remember that sprain and strain are injuries and you need to know the first aid for this. So sprain, the blue one, is injury to ligament. So what is ligament? It is, huh?
Bone to bone. Yeah.
Correct. It's a tissue that connects bone to bone. And the strain is here to the tendon. And what is the function of the tendon?
Bone to muscle. Just a
Correct. Connects bone to muscles. So it's very good that the first aid is the same for both situations. That's why you don't have to differentiate. And you need to know also the fracture. What is fracture? It is when bone is injured. Yes, broken bone. Not the joint, but bone. Because if the joint is injured, it is called dislocation, yes, or luxation. And this dislocation is injury to a joint. It means bones are okay, just where they meet and they come together in order to make a movement, They are not in their place. That's why you can see asymmetry. That's why the patient cannot open or close the joint. Yes, because we have injury to joint. So by tomorrow, please remember the definition of sprain and strain, the definition of the fracture, and the definition of dislocation. What do they mean? What is happening in the body? Okay, let me go to chat for a second. Yes, excellent, correct. Okay. So it's difficult to understand, is it strain, is it sprain, fracture, or dislocation? Whatever it is, it doesn't matter. You don't have to lose the time to think, oh, is it sprain, is it dislocation, or is it fracture? No, you don't have to do it. Just do the first aid. Help the patient with RICE. RICE helps you to remember what we need to do. So what is it? R stands for rest, I stands for ice, C stands for compression, to compress, and E stands for elevation. Yes, it need to rest for 48 hours. We put an ice for 20 minutes at a time for 8 times per day. We compress it, put the pressure to help reduce swelling, and we elevate 6-10 inches above the heart. So this is applicable also for venous stasis when we see that legs are swollen. Maybe it is due to vessel problem. Yes, we elevate it above the heart level and the swelling is reduced. Is it clear?
Yes.
So remember that we immobilize. In addition to resting, in addition to compression, we need to tie it so that it doesn't move. Yes, and that's why there are lots of splints. We put it on the injured part and then we tie it with special cloths so it doesn't move until they get to the help. We have 2 people waiting to join to the class. Okay.
My Zoom just has been disconnected 2 minutes ago and then was connected. I don't know why.
Oh, maybe it is due to internet problems because do you have kids doing Zoom at home?
Yeah, I have 2 children now. They are doing Zoom too.
Yeah, maybe it is because of internet.
Maybe.
So after applying splint, you need to remember what to do in order not to have compartment syndrome. What is compartment syndrome? When we tie the extremity too tight and the blood cannot go to this body part. That's why whenever we tie the part, let me go to the picture. So we tie this, even if the injury is here, we tie so that the finger, the toes, they stay open. Why it is very important? Because if you don't have toes open, you cannot understand if the blood flow established normally or you tied so tight that the blood cannot reach to the toes. That's why we keep fingers open. It doesn't matter, is it hand or leg, fingers and toes need to be open. So skin color and nail beds. If after you tie, after 15 minutes, 10 minutes, 20 minutes, they become bluish, cyanotic, it means it is too tight, blood cannot go there, the patient will have more pain, the patient will have tingling, and you need to take care right away. So locate pulse in artery distal to affected extremity. So if you tie here, if the injury is here, you locate the pulse here. So it depends where you tie. If you tie an injury is on the thigh, you go to dorsalis pedis. You check the pulse on the foot, lower part, to understand the blood. Is the blood reaching to the organs or not? And watch for increasing swelling. If it becomes more swollen, this is another hint that you know that the blood is not going there. So what to do in this case? we made it a little loose, and you can see that nail beds are not blue anymore. It means the blood reaches there. It is optimal pressure, not loose and not tight. Is it clear?
Yes.
So why do we apply the splint?
To immobilize the place where the like trauma happened.
Correct, not to worsen the situation, yes, to prevent injury to soft tissues, because if there is a broken bone and the patient moves the hand, it can hit and injure the muscles, vessels, nerves that are next to it. That's why we immobilize. So cardiovascular emergencies, we have 1.5 minutes. So do you have any questions? Maybe we'd better discuss what questions we can have and do the neurology later and cardio. Any questions? Let's go over all the things that we did, the ones that are important. So what is sprain and strain? Please unmute yourself, all students, unmute so you could answer. Sprain and strain. This T can help you. T stands for tendon, yes?
The sprain
Injury to the tendon.
the
is
broken
ligament.
part from the muscle to the bone.
Dislocation injury for joint.
And what do we do? If it disconnects, please, my apologies, we have just seconds.